Hello, Mr. Lawson.
Yep.
I am Anita, one of the nurses here. This is Whitney, another one that's going to be helping me out today. We see that you're here for chest pain.
Mm-hmm.
All right, tell me what's going on. What happened?
I was sparring with a buddy. He got me really good and he took me to the ground. And after that, we kind of stopped.
Okay.
I went home and I didn't feel good. I didn't feel right, so I came here.
Okay. How are you feeling? What's hurting? What's going on?
Like everything, my whole upper body hurts, my whole chest, my back.
Okay. On a scale of 0 to 10, what is your pain level?
Like an 8, 9.
Okay. All right. Have you taken anything over the counter?
No.
Okay. When did this happen? Like a couple of hours ago, last night, today, this morning? Okay. All right. Any dizziness?
No.
Okay. Any shortness of breath going on?
Yeah,
some shortness of breath?
Yeah, it hurts to breathe in.
All right. We're gonna go ahead and get you on our bed, and we're gonna do a little bit more assessment. Okay. We're gonna listen to you, see how you're breathing, get some vitals on you. And we're gonna kind of just go from there and work up and see what's going on, okay? See if we can help you out today.
Okay.
All right, so, wanna help you up to the bed?
Let's get you on the bed.
Do I have to lie down?
Yes, flat.
Are you okay?
Yeah, it hurt. It just hurts.
Okay. Is it less when you sit up?
Yeah, it was better.
Let's go ahead and sit back up.
Can you help me?
Okay. I'm gonna put an EKG on you.
I'm gonna get your blood pressure. Does it help a little bit sitting up? Here it is. I'll put this on the opposite hand. Yeah. Can you watch that for me? Let's see.
Okay. Your oxygen's at a 90, so we're gonna go ahead and hook you up to some oxygen. I'm gonna put it at 2 liters.
Okay.
Your blood pressure's a little low. 90/60.
Okay, that's way lower than usual.
What's your normal?
I think last time it was like 130/90 or something like that.
Let's see, I'm gonna go ahead and listen to you, okay?
What do you?
So with all of your symptoms presenting, I'm gonna see if the doctor wants to order a chest x-ray.
Okay.
How does EKG look?
Oh, there is a slight elevation on an EKG.
What is that?
It just means you
That's something.
have a little bit of a dysrhythmia.
So something's definitely going
Something's
on.
different with your heart.
Okay. To get started, we're gonna go speak with our provider. Let's see. Let us speak with our provider and just kind of rest there a minute, and we'll see what he wants to do further. Since we started the EKG, your vitals are a little off, a little abnormal, so.
Let's see if he wants to do that chest x-ray.
Okay.
Okay, how long am I gonna have to sit here?
Just give us like, till we go speak to him. If any pain is worsened, then definitely here's the button to push the button, okay?
Thank you.
All right, Mr. Lawson, how are you feeling? How you doing?
Same.
Same, okay. Well, after we talked to the provider. He did review your EKG results. And then we told him that we gave you some oxygen because your oxygen was a little lower than normal than we like. And the x-ray, he wants us to go ahead and get you some labs.
Okay.
Okay, those labs are just like we're gonna do troponin, white blood count, ESR, CRP. Those are just to tell us if something is going on with the heart, if there's any inflammation, anything like that. Since you said the chest pain, that is number one for us. We're gonna need to rule out anything that could be going on with that.
Okay.
Okay.
Okay. And we are going to get you started on some IV Toradol and some fluids.
IV.
Yes. We're going to start an IV. Okay, I'm going to start the IV. Okay, get your fluids. And are you familiar with Toradol?
No.
Okay, it's just an anti-inflammatory. It's going to help with inflammation.
Okay.
Okay.
It's also gonna help with your pain. So any pain that you got going on right now,
How fast?
it'd probably help within like 20-30 minutes.
Okay.
And keep you some fluids and keep you hydrated while you're here.
Am I gonna have to just sit here the whole time?
You can lay in the bed, but be sure that you lift up the head of it because that's gonna relieve the pressure on your chest and it's gonna help with the pain you're feeling. Leaning forward is gonna help.
Also, so you can do either one, whichever one is comfortable for you. We can keep you elevated if you want to lay down, or you can lean forward, whatever helps for you, whatever's comfortable for you.
How elevated?
At least 30 degrees and up.
Okay, I'm gonna stay like this for a while.
Okay.
Okay. And just let us know if it gets worse. Okay? You have your call light. Call us if you need us.
We'll come back in here as soon as we get the labs back and the provider reviews them, and we can hopefully have some answers for you or what we can do next to help with your pain or.
What was it called that you're giving me?
Toradol.
Toradol? Okay.
Yeah. All right, so give us a call if any symptoms worsen, if anything you feel like you're gonna pass out, anything like that for sure. We'll come in here and be checking on you, okay?
Okay, and I just press the button?
Yes, sir.
Okay.
All right.
Okay, Mr. Lawson, we got your labs back and your troponin was negative, so that's good. Doesn't mean you're having a heart attack. It means you're not having a heart attack. Did I say that right? And your white blood cells were elevated and your ESR and CRP were elevated as well.
Okay, I don't know what that means.
That just means that there is a sign of inflammation in there.
Okay.
So it's swollen.
More than likely it's around your heart since you're having your chest pain going on.
Swelling around my
Yes.
Yeah, well, there's like a sac around your heart that keeps it. What do you call that?
Girl, you went too far.
You know, so it's got fluid in there. There's fluid in that little sac that's around your heart. So it's causing the pain. It's causing the
Pericardial.
inflammation. Yes.
Okay.
Okay.
So we're gonna go ahead and take another set of vitals. See how you're doing. How are you feeling? What's your pain? On a scale of 0 to 10.
I don't know, like 7 or 8 still.
7 or 8. Let's see if we can get you something else for pain besides that Toradol. We're gonna go ahead and take it here. Feeling any dizziness going on? Feeling like you're gonna pass out?
It's just hot in here.
It is hot in here.
Your blood pressure's still a little low. It was 90 over 60, now it's 100 over 72, so
What
it's
is it?
still a little low. And then we're gonna get your temperature. Let's see your temperature. We're at 100. Look at this, we're gonna see what your oxygen is, see if we
So
need
your-
to turn up the oxygen or not.
Temperature is still the same, but it's not elevated any, so that's good.
And then let me go ahead and listen, get your heart rate. pretty. Okay, let me listen to you as well.
And your oxygen's gone up just a little bit, so we're still gonna leave that cannula in.
Okay. Let me listen to that. And does the pain help if you're sitting up, leaning forward, or do you wanna be laying down?
I don't wanna move, I wanna be like this.
Okay. Alright, well, your vitals are still, they're okay, they're a little bit better, but they're not what we would like to see in
What,
this situation.
what are you wanting them to be?
What's your normal? Cause that's still pretty low, like 120/80 is normal for a patient, but everyone's different. What is your normal?
I don't know, like I think I told y'all last time, I think it was like normal, like 130/90 or something like
Yeah.
that.
Okay, well, that's still too low. And then it could be like that even with your pain level. Let me monitor your breathing real quick. Let's see. You're breathing pretty heavily.
Mm-hmm.
You're at 26 right now. Okay. Alright.
How long do I need to be on this thing?
Well, we're gonna go let the provider know that what your vitals are now and your pain level and see if we can get you something for the pain to help it,
Okay.
since that's not going away. And then we'll be back in here, okay? Push the button if you wanna lay down, and then we'll just position you to kind of stay elevated, or you can sit like that. Or if you need our assistance.
Mm-hmm.
Thank you.
Okay, Mr. Lawson. So we got all the results in, and with everything going on, the doctor has came to the conclusion that it is acute pericarditis. That
What
is inflammation of the sac around your heart, and it's probably from the trauma you were telling us about getting hit the other day, or this morning.
Yeah, it was,
This morning. And so we're gonna go ahead and admit you into the hospital for a stay for a few days.
why?
So that we can observe and monitor, make sure nothing else goes on wrong.
Yeah.
Can't I just go home and call if something happens?
No, your heart's that's a pretty important factor, so we're gonna go ahead and keep you, and just to make sure, observe, make sure that no further testing or treatment needs to be done. This can resolve in days, it can resolve in, weeks.
Weeks?
So, yes, but we're not trying to keep you weeks, so you came as soon as this was going on, and the earlier the better. So that's what we're gonna do, is keep you and just make sure, as long as everything, we're gonna give you some other medication, depending on his plan of care and what he wants to do, and then we'll go from there.
And if you're still in pain, we'll see if we can get you something else for the pain. We'll ask the doctor.
Why do I have to stay? What do you,
We need to make sure that this is not gonna get any worse.
where's how?
Well, the fluid around it can fill up, and then we have to do further
It's harder for
further
everyone to
testing
monitor.
that we have to do. It can be lead up to a paracentesis
Your
where they
heart
have to
can't
drain
pump as
that.
well with all that fluid in there.
Okay.
Yeah, so it's better to just stay, let us get you.
What was that thing you just said?
The paracentesis, that just drains fluid, since that's what, you have the inflammation, that can lead to the fluid around the heart, and then,
You can't just do that now?
no, that's not the first line of treatment that we do in this situation. We try to be the less invasive until we go into that needed, and that's not needed right at this moment, but it can lead to that.
Okay.
Alright, well, here's your button. Call us if you need anything, okay? We'll get you into a room as soon as we can. We won't be down here. This is the emergency room. We'll get you up to like our